So next group of bacteria which we are going to discuss here, they are spirochetes. Spirochetes, they are also gram negative and elongated, motile, flexible bacteria which are twisted spirally round the long nexus. So like when you leave one rope or some ribbon, how it curls around its axis, same like that it looks like. So it is a elongated and flexible bacteria, and it is twisted around its own axis. So it is twisted spirally around its own long axis. So it they vary. So there are varying number of fine fibrils between cell wall and cytoplasmic membrane. So between the cell wall and cytoplasmic membrane, there are fine fibrils. Varying number of fine fibrils are there between cell wall and cytoplasmic membrane of a bacterial cell. So this spiral shape and serpentine motility of a cell, it depends on the integrity of these fine fibrils, that is filaments. So this especially these spirochetes, they don't have any flagella or anything else, but they show three types of motility, that is flexion and extension. By flexing the long axis and extending, they move from one place to other place. And corkscrew like rotatory movement. Corkscrew means how you rotate the bottle cover. So same like that, corkscrew like rotatory movement also makes some motility here in spirochetes, and translatory motion. So these three types of motility are shown by spirochetes: flexion and extension, corkscrew like rotatory movement, translatory movement. So these spirochetes, they belong to the order Spirochetes, which is divided into two. So that is Spirochetesiae and Treponemataceae. So this Treponemataceae, they are human pathogens, means they cause infections among human beings. Treponemataceae. And Spirochetesiae, they are saprophytes. They are seen on dead and decaying materials. Spirochetesiae. So these are the uh, two types of spirochetes actually. So they are Spirochetesiae and Treponemataceae. So again this Treponemataceae is divided into three genera: Borrelia, Leptospira and Treponema. Borrelia, Leptospira and Treponema. These are the three genera of Treponemataceae. So we are going to study this Treponemataceae in detail because they cause infections among human beings. Treponemataceae under spirochetes. So it is having three genera, that is Borrelia, Leptospira, Treponema. So next let us discuss about one of the type of spirochete, that is which comes under Treponemataceae. So that is one of the three genera in a Treponemataceae, that is Borrelia. So Borrelia, it is a large, motile and refractive with a irregular size and wide and open coils. It is having wide and open coils like a hair. How you see the hair, it is coiled and curly hair. So it is coiled and long, elongated. Same like that it looks like. So it is 0.3 to zero point 0.7 micron wide and 10 to 30 micron long. It is long, 10 to 30 microns, and it is a gram negative bacteria. Borrelia, it is medically very important because it causes relapsing fever and fusospirochetosiae. So these are the two conditions, especially relapsing fever. It is of most important. So next let us discuss about the Borrelia recurrentis. So Borrelia recurrentis. So morphology of this Borrelia recurrentis, it is Irregular spiral with one or both ends pointed, one or both ends they are pointed. So it is 8 to 20 micron into zero point 0.2 to zero point 0.4 micron in size, 0.2 to 0.4 micron wide, and 8 to 20 micron length. So it is elongated spiral, and ends are pointed. It possesses 5 to 8 loose spiral coils, actually 8 to 10, or sometimes 5 to 8. It is actively motile, it shows a motility, and it stains best with the Giemsa and Leishman's stain. Next, let us discuss about the second genre of Treponemataceae, which causes infections among human beings, that is Leptospira. Leptospira. So, Leptospira is actively motile and delicate spirochetes, and it possesses a number of closely wound spiral and characteristic hook ends, and very thin, and is seen under dark ground illumination. So very thin it is, and can be seen in a dark ground illumination. So it does not take any stain. So there are many different types of leptospira which cause infections among human beings. So morphology of leptospira, it is 7 to 17 micron long and zero point 0.1 micron broad. Coils are many, small, and closely set. The ends are hooked. It is actively motile and rotatory movements are seen. And it may be stained with the Giemsa stain, but it will not readily accept the stains. But after a long time, it may get stained with a Giemsa stain or silver impregnation. So cultural characteristics, they can be cultured on a media enriched with a rabbit serum, and it is aerobic microaerophilic with the optimum temperature of 25 to 30 degrees centigrade and pH 7.2 to 7.5. So it may grow on chorioallantoic membrane of chick embryo. Chorioallantoic membrane of chick embryo, it can grow on that chick embryo. And culture may be obtained by inoculating the material intraperitoneally in a guinea pig, and culture the heart blood 10 minutes later. So means if you inoculate the material intraperitoneally in a pig, if you take the blood from the heart, it can show the leptospira. So that is about cultural characteristics. Then resistance, about resistance, it is susceptible to heat, means if you heat for 10 seconds, it can die at a degree temperature of 60. It can die within 10 seconds. And acidic pH, that is less than 6.8, it can kill the leptospira. And salt water also, you all may be knowing fruits and vegetables we wash with the salt water. So the reason is this only: salt water irritates leptospira, they can die, all bacteria almost they can die. So bile also, bile salts will be there in bile, so that also destroys them very easily. And leptospira, they die within 3 minutes in a water which contains 1 parts of chlorine. So these leptospira, they are very sensitive to penicillin, streptomycin and tetracycline antibiotics. If you use penicillin, streptomycin and tetracycline, you can control the infection of leptospira. So next, let us discuss about the pathogenicity of leptospira. So Weil's disease is caused by leptospira. It is an acute epidemic infection. It is characterized by jaundice, hemorrhage from mucous membranes, and there will be a fever, enlargement of the spleen, that is called as splenomegaly, and there will be an infection of the kidneys, that is nephritis. These group of symptoms are exhibited in Weil's disease caused by Leptospira. So this Leptospira, it is found in a wild rat. So wild rat acts as a important reservoir for Leptospira. So human infection, it may result from contaminated water and food by the Leptospira. So, this contaminated food and water may cause infection among human beings. So, less frequently the organism enters through the cut wound, means if the person is having some wound on the hands or legs, so very rarely the Leptospira can enter through that abrasions in the skin. So incubation period of this Weil's disease is 1 to 8 weeks, very long incubation period. So this Leptospira is found in bloodstream and distributed throughout the body. So Leptospira enters into the blood and it gets distributed throughout the body in all the body organs. So what happens next is the Leptospira starts settling down in some of the organs of our body like liver and kidney. So and even central nervous system also, brain and all. So brain, liver, kidney. So this Leptospira starts settling down. So that causes some infections and problems related to liver, kidney and nervous system. And even it can cause meningitis also. So there will be some mm, the because of the involvement of the kidneys in the infection. So if you take a collection of urine and if you study, so there will be a large number of Leptospira are seen in urine because kidney is the site of infection. So the Leptospira, they pass into the urine. So if you can do the study of urine, you can detect Leptospira in urine of the patient who suffers from infection. Next, this is all about pathogenicity of Leptospira, and the treatment of this Leptospira infection includes use of penicillins and tetracyclines. So if you use penicillin and tetracycline, you can cure the infection of Leptospira. So next let us discuss about the pathogenicity of Borrelia recurrentis. So as we discussed earlier, Borrelia recurrentis causes relapsing fever among the human beings. So this relapsing fever is characterized by splenomegaly, means enlargement of the spleen. Jaundice, yellowish discoloration of the mucosal layers of the body, means there will be increased bilirubin levels in the blood, that is jaundice. It may cause jaundice, impair the functioning of the liver. And hemorrhagic lesions in the kidney, it may lead to some rupture of the capillaries in the kidney, and it may lead to hemorrhagic lesions in the kidney and even in intestines also. And it may cause meningitis, like inflammation of the covering of the central nervous system, that is meninges. It may cause meningitis. So this is called as relapsing fever caused by Borrelia recurrentis. So incubation period of this infection is 2 to 10 days. So after the incubation period, the person starts showing symptoms, and within 3 to 5 days, the person may recover from the infections. And Borrelia are not demonstrable in the patient's blood after 10 days. So after 10 days, if you take out the blood of a patient, you cannot recognize the Borrelia in blood of the patient. The disease subsides after 3 to 10 relapses. So this is about Borrelia recurrentis, which causes relapsing fever characterized by enlargement of the spleen, jaundice, hemorrhagic lesions in the kidney, intestine, and meningitis. So these are all some of the symptoms of relapsing fever caused by Borrelia recurrentis, it is called as. So second type of Borrelia, it is Borrelia vincenti. So it is also motile spirochete, having a size of 4 to 20 micron long and 0.2 to 0.6 micron wide, having 3 to 8 coils of variable size. It is also gram negative bacteria, and it is obligatory anaerobic and normal commensal of mouth, means it is seen in the mouth commonly. But when the person's condition becomes weak, when he becomes immunity goes down and malnutrition because of anemia or any other conditions, if the person loses his stamina or if he becomes weak, so this common existing Borrelia vincenti in the mouth starts causing some infections like gingivostomatitis or oropharyngitis. Gingivostomatitis or oropharyngitis means inflammation of the gums, that is gingivitis called as. Stomatitis means inflammation of the mucosal layer of the mouth, and oropharyngitis means inflammation of the oral cavity and pharynx. So this is another uh, bacteria, that is Borrelia vincenti, gram negative, obligatory anaerobic, having size of 4 to 20 micron long and 0.2 to 0.6 micron wide. So it is found in mouth normally. It will not cause any infection, but when the person becomes weak, it starts showing its effects, that is it leads to gingivitis, stomatitis, or oropharyngitis, like that it will cause infections. That is about Borrelia vincenti. This is all about Borrelia, the first genera of Treponemataceae. Under that, Borrelia, Leptospira, and Treponema. There are three genera. So in that, Borrelia contains Borrelia recurrentis, which causes relapsing fever, and Borrelia vincenti, which causes fusospiroketosis. So that completes Borrelia. So, Borrelia infection can be controlled by some of the antibiotics such as penicillin, tetracycline, streptomycin. They all can be used safely and effectively to treat the infections caused by Borrelia.